topic of concierge services and personalized support, whereby the teams who are handling that patient, be it at the airline level with Kenya Airways or any other airline, be it at the hospitals, you have that nurse who is able to train the rest of the team, be in charge. Nurses are leaders, and as a leader, you will be able to work with the rest of the team in training and building capacity with them. Secondly, there is the work of interpreters. We spoke about people coming into the country. We saw from the data that was given by KTV that people even come from Burundi, from Rwanda, UK, and USA. As a nurse, if you go out and just learn an extra language and you can be able to interpret that, because you know the speciality, you know the language which is being spoken internally at the bedside, in the theater, in the oncology clinic, and you are able to translate that into the patient and the relatives. That is another big opportunity. In Kenya, we are taking nurses to Germany and to Italy, and they have to learn the language before they leave Kenya to be accepted on the other end. So why don't we, as nurses here, learn that language, the French, the Spanish, that we can be able to help in the medical tourism space. There is content creation. The Gen Zs in the room, the younger generation, will talk about a lot of things going on the internet. So if you're talking about the social internet area, the content creation, nurses can be able to create content and disseminate this information to people out there, even in telemedicine, whereby we can make it very, very easy for you to access information about medicine, about healthcare, about wellness. So that is another area, and I want to just reiterate on content creation. Lastly, nurses can go into mainstream entrepreneurship, where you can look at a niche area, an area that has not been occupied a lot, and there are many of them. So look at that niche area where, as a nurse, you trained. Nairobi Hospital has got very good products. We've got nurses who are renowned worldwide, Australia, Canada, everywhere. So that niche area, and I'm glad to report that yesterday I was talking to a friend of mine who is doing home births. She's a doula. And with this, people come to her. She doesn't have to go out, and she's able to take the profession of nursing out there. Thank you.
Just to add, we are so much on advocacy to showcase Kenya as a destination to our healthcare programs across Africa. And we are affiliated to international bodies and also European bodies. And these are the areas where we can tell them the products that we are having in Kenya, areas where we are strong in, so that we can get returns from them to Kenya. We are also having nurses who have excelled globally. We can use them as ambassadors and champions to showcase Kenya as the hub of quality healthcare provision. At the same time, we have got, as she said, most nurses are also in the entrepreneurship positions. They can. We are able to provide care in transit and also in home-based care. So when these patients come from across the region and internationally, they'll be sure of getting the quality services. Even as they wait for further interventions, they'll be sure to be attended to. Thank you.
Right. We'll turn to Dr. Ahmed. As you answer that question on how you manage infectious diseases on board, possibly want you to clarify what kind of cases you can take on, which ones belong to air ambulances, and as is life, some people seek care and come back having transmission. Just to give the travel a bit of that process when it comes to body negotiation and the things required, because they'll handle cases as such.
So maybe on the cases that we do a commercial airline in the cases that will definitely require an ambulance. So this is a case-by-case basis. I cannot say this qualifies for ambulance and this qualifies for commercial airline transport. But as I have said, we have stretchers, we have oxygen, we can provide uplifting for serious cases, but it's case-by-case basis. We assess, is there any advantage for the patient taking the